If we do that, we can build a healthcare system that allows you to be physicians instead of administrators and accountants. A system that gives Americans the best care at the lowest cost. A system that eases up the pressure on businesses and unleashes the promise of our economy. Creating hundreds of thousands of jobs, making take-home wages thousands of dollars higher. And growing our economy by tens of billions of dollars more every year. That's how we'll stop spending tax dollars to prop up an unsustainable system. And start investing those dollars in innovations and advances that will make our healthcare system and our economy stronger. That's what we can do with this opportunity. And that's what we must do with this moment. Now, the good news is that in some instances, there's already widespread agreement on the steps necessary to make our healthcare system work better. First, we need to upgrade our medical records by switching from a paper to an electronic system of record keeping. And we've already begun to do this with an investment we made as part of our Recovery Act. It simply doesn't make sense that patients in the 21st century are still filling out forms with pens on papers that have to be stored away somewhere. As Newt Gingrich has rightly pointed out, and I don't quote Newt Gingrich that often, we do a better job tracking a FedEx package in this country than we do tracking patients' health records. You shouldn't have to tell every new doctor you see about your medical history or what prescriptions you're taking. You shouldn't have to repeat costly tests. All that information should be stored securely in a private medical record so that your information can be tracked from one doctor to another, even if you change jobs, even if you move. Even if you have to see a number of different specialists. That's just common sense. And that will not only mean less paper pushing and lower administrative costs. Saving taxpayers billions of dollars, it will also mean all of you physicians will have an easier time doing your jobs. It will tell you, the doctors, what drugs a patient is taking so you can avoid prescribing a medication that could cause a harmful interaction. It will prevent the wrong dosages from going to a patient. It will reduce medical errors, it's estimated, that lead to 100. Lives lost unnecessarily in our hospitals every year. So there shouldn't be an argument there. And we want to make sure that we're helping providers computerize so that we can get the system up and running. The second step that we can all agree on is to invest more in preventive care so we can avoid illness and disease in the first place. That starts with each of us taking more responsibility for our health and for the health of our children. It means quitting smoking. It means going in for that mammogram or colon cancer screening. It means going for a run or hitting the gym. And raising our children to step away from the video games and spend more time playing outside. It also means cutting down on all the junk food that's fueling an epidemic of obesity which puts far too many Americans young and old, at greater risk of costly, chronic conditions. That's a lesson Michelle and I have tried to instill in our daughters. As some of you know, we started a White House vegetable garden. I say we generously, because Michelle has done most of the work. That's a lesson that we should work with local school districts to incorporate into their school lunch programs. Building a healthcare system that promotes prevention rather than just managing diseases will require all of us to do our parts. It will take doctors telling us what risk factors we should avoid and what preventive measures we should pursue. It will take employers following the example of places like Safeway that is rewarding. Workers for taking better care of their health while reducing healthcare costs in the process. If you're one of 3/4 of Safeway workers enrolled in their Healthy Measures program, you can get screened for problems like high cholesterol or high blood pressure. And if you score well, you can pay lower premiums, you get more money in your paycheck. It's a program that has helped Safeway cut healthcare spending by 13%. And workers save over 20% on their premiums. And we're open to doing more to help employers adopt and expand programs like this one. Our federal government also has to step up its efforts to advance the cause of healthy living. Five of the costliest illnesses and conditions: cancer, cardiovascular disease, diabetes, lung disease, and strokes can be prevented. And yet only a fraction of every healthcare dollar goes to prevention or public health. And that's starting to change with an investment we're making in prevention and wellness. Programs that can help us avoid disease that harm our health and the health of our economy. But as important as they are, investments in electronic records and preventive care. All the things that I've just mentioned, they're just preliminary steps. They will only make a dent in the epidemic of rising costs in this country. Despite what some have suggested, the reason we have these spiraling costs is not simply because we've got an aging population. Demographics do account for part of rising costs because older, sicker societies pay more on health care than younger. Healthier ones, and there's nothing intrinsically wrong in us taking better care of ourselves. But what accounts for the bulk of our costs is the nature of our healthcare delivery system. Itself a system where we spend vast amounts of money on things that aren't necessarily making our people any healthier. A system that automatically equates more expensive care with better care. Now, a recent article in the New Yorker, for example, showed how McAllen, Texas, is spending twice as much as El Paso County, twice as much, not because people in McAllen, Texas, are sicker than they are in El Paso, not because they're getting better care or getting better outcomes. It's simply because they're using more treatments that, in some cases, they don't really need. Treatments that, in some cases, can actually do people harm by raising the risk of infection or medical error. And the problem is this pattern is repeating itself across America. One Dartmouth study shows that you're no less likely to die from A heart attack and other ailments in a higher spending area than in a lower spending one. There are two main reasons for this. The first is a system of incentives where the more tests and services are provided, the more money we pay. And a lot of people in this room know what I'm talking about. It's a model that rewards the quantity of care rather than the quality of care, that pushes you. The doctor, to see more and more patients even if you can't spend much time with each. And gives you every incentive to order that extra MRI or EKG, even if it's not necessary. It's a model that has taken the pursuit of medicine from a profession, a calling, to a business. That's not why you became doctors. That's not why you put in all those hours in the anatomy suite or the OR. That's not what brings you. Back to a patient's bedside to check in, or makes you call a loved one of a patient to say it will be fine. You didn't enter this profession to be bean counters and paper pushers. You entered this profession to be healers. And that's what our healthcare system should let you be. That's what this healthcare system should let you be. Now, that starts with reforming the way we compensate our providers, doctors, and hospitals. We need to bundle payments so you aren't paid for every single treatment you offer a patient with a chronic condition like diabetes. But instead paid well for how you treat the overall disease. We need to create incentives for physicians to team up. Because we know that when that happens, it results in a healthier patient. We need to give doctors bonuses for good health outcomes. So we're not promoting just more treatment, but better care. And we need to rethink the cost of a medical education, and do more to reward medical students who choose a career as a primary care physician who choose to work in underserved areas instead of the more lucrative paths. That's why we're making a substantial investment in the National Health Service. Core that will make medical training more affordable for primary care doctors and nurse practitioners so they aren't drowning in debt when they enter the workforce. Somebody back there is drowning in debt. The second structural reform we need to make is to improve the quality of medical information making its way to doctors and patients. We have the best medical schools, the most sophisticated labs. The most advanced training of any nation on the globe. Yet we're not doing a very good job harnessing our collective knowledge and experience on behalf of better medicine. Less than 1% of our healthcare spending goes to examining. What treatments are most effective? Less than 1%. And even when that information finds its way into journals, it can take up to 17 years to find its way to an exam room or operating table. As a result, too many doctors and patients are making decisions without the benefit of the latest research.